Hello, I'm Isha. I'm the clinical coordinator at the Royal London Hospital. Thank you for taking the time to watch this video about how we use lumbar puncture in research. Diagnosing Parkinson's disease can be difficult. Unfortunately, there is currently no single test, such as a blood test, that can give us a conclusive result. People may face delays in receiving a diagnosis and longer waits to access support.
Hi, my name is Kamalesh. I'm working as a postdoctoral fellow in Queen Mary University of London. In this section, I'm talking about what is lumbar puncture and why do we do it. So research has shown that taking a small sample of cerebrospinal fluid, a liquid which surrounds the brain and the spinal cord, could be very useful test to diagnose Parkinson's disease. If the brain is damaged or disturbed in some way, changes in this fluid occur. Looking at this fluid can help us to understand what is going on in the brains of people with Parkinson's disease and help improve the way we diagnose and treat the Parkinson's disease.
By doing this, they will find, hopefully, they will find some cure or something that will make it easier.
Hello there, my name's Dr. David Gallagher. I'm consultant neurologist here at Royal London Hospital, and I'm going to talk to you a bit today about the use of lumbar puncture in research. The process of taking a small sample of cerebrospinal fluid is called a lumbar puncture. This is a very common test that we use routinely in clinical practice to diagnose conditions such as multiple sclerosis, other immune conditions of the nervous system, infections and dementia. In this video, we'll talk about use of the lumbar puncture in research. But over time, we believe that this will become a common test used in clinical practice for Parkinson's disease.
I would definitely recommend it. I mean, everything we can help for future patients is great. And it was an easy procedure to do. It wasn't painful, and I'm glad to have done it myself.
Hello, my name is Caroline Dudu, and I'm the Parkinson's clinical nurse specialist. The lumbar puncture takes place in the hospital, and it lasts about 20 minutes, with some time for preparation beforehand and rest afterwards. Firstly, the team will discuss the procedure with you, explaining the risks and benefits. You will be given plenty of time to ask any question you might have. You will then be able to decide if you want to go ahead with the test.
I remember going in and being given some explanation.
There was no pain, there was no tingling, there was no lightheadedness. I just literally walked out of the hospital, got back on the train and went home.
Your spine is made up of bones called vertebrae, and we want to get into the space between the bones. The best way to do this is to lie on your left side with your head and legs tucked in to open the spaces between the bones of the spine. If lying down is too difficult for you, we will ask you to sit up, bending slightly forward with your chin tucked in. Once you are comfortable in the position, we will find the best space between the backbones with our hands. We will clean this area and deliver a numbing agent. This can sting a little bit, but it should not be too uncomfortable. A needle is then inserted into the area and about a tablespoon's worth of fluid is taken. Once we have collected the sample, we place a plaster on your back and ask you to lie down for half an hour. We usually also collect a blood test while you are resting after the procedure.
What are the possible risks? I am Alex. I'm a trainee doctor and PhD student at Queen Mary University of London. A lumbar puncture is considered very safe and is undertaken by experienced doctors. As it involves needles, there is a small risk of infection or bleeding. We minimize this by using clean, sterile equipment. We may also need to check that your blood is not too thin before we start. Around 1 in 20 people who undergo a lumbar puncture experience a headache afterwards. This is usually mild and can be helped by lying down flat, drinking water or caffeinated drinks, and taking paracetamol. Others may experience tingling or back pain. However, this often goes away quickly with simple painkillers like paracetamol. To prevent this, we encourage you to rest for 30 minutes following the procedure before traveling home.
No problems whatsoever. I think my back was a little bit stiff the next day, but nothing serious at all.
I don't worry about that. It's all simple technique. patient happiness. Yeah, happy. I could remember it wasn't anything dramatic. I've had worse pain in my hips than that.
Hello, my name is Natalie Donko and I am the research assistant. After one of the doctors has taken the spinal fluid sample at the hospital, I come to collect the sample and transport it to the laboratory. Next, I want to give you a visual of what we do with the sample in the laboratory. I spin the spinal fluid samples to remove the heavier particles from the fluid. I then transfer the cleaned fluid, which has all the molecules of interest, into smaller tubes ready for analysis. The samples will then be stored until I ship them for biomarker analysis.
Using lumbar punctures could drastically change how Parkinson's is diagnosed in the next few years, but it is vital that research behind this is both high quality and representative of those with Parkinson's. To do this, we brought together a great team of health professionals, researchers and charities, and now we need your help to improve these tests and develop better treatments for Parkinson's.
They cannot do it without you and me. So let's get together and give them assistance. I could do some research into a cure.